Hey everyone, Dr. Skylar Baku here. In this video, I'm just talking about what's going on post-COVID with the so-called the long haulers, or the people that are being affected or have symptoms long-term even after they're recovered. So we're seeing things, of course, like the loss of taste and smell still not coming back, even months later. I just had a patient that called from Atlanta, and again, 3-4 months, still no taste and smell. And same thing as someone from Canada emailed me as well, asking what do we do about that. I've also seen, of course, the shortness of breath. I've seen the chest tightness, even some of the just discomfort in the chest. I even recently saw someone who's been suffering from dementia-like symptoms since they were sick and recovered. I mean, they were having memory problems, trouble finding their words. They were even having trouble doing their brain games. And so it's kind of an interesting thing, and what I want to talk about is, okay, what's going on here, what's happening? So the virus is obviously creating some kind of damage to especially nerve function. That's what we're seeing in the taste and smell, and then even like damage to your bronchioles and your lung function and things like that. But even more importantly, we're seeing damage to the brain, or inflammation to the brain, and we know that was a big hallmark of COVID that made it different than a lot of other flus, was the inflammation factor. And that's what I truly believe is going on as far as why the damage has happened and maybe why it's continuing as well. So a couple things that we've been doing in the office to help these, especially for the taste and smell, I use a technique called quantum neurology. That's a technique that rehabilitates the nervous system. So it's for complete neurological rehabilitation. And what we're doing with that is we're doing things like having the patient smell or taste something and using the infrared light to rehabilitate that while we're doing a specific muscle testing to create quantum neurology we call is neurological recognition. So it's getting the brain to see that there's the weakness and then exercising it to basically strengthen it again. So think about the nerve got damaged, it functions like a dimmer switch on a light. The power just came down, it's not working, maybe it completely shut off, we don't have any taste or smell. But typically what we see is like, you know, it's functioning at 10% or 20% or something low like that, and then we're just turning that power back up again using some specific stimulation and rehabilitative exercises with the red light. And maybe I'll do a little video that'll show kind of specifically how we do that. The other thing is we're using oxygen therapy. Oxygen has been used to heal a lot of things. I mean, especially good for that brain inflammation, but also using it as something to heal the tissues in general. Because I had a guy that just came in, and his oxygen was great. You know, we were getting oxygen to the brain, but we were then just using it as a rehabilitative tool, not necessarily something just to get his brain oxygen back up. So that's another great thing that we've been using is the Live O2 system that we have for, it's called an adaptive contrast exercise with oxygen therapy. That's works super well for, any of our brain-related issues, but especially for this COVID type recovery that we're looking at for the lungs, even and the brain function. So I hope that clears up what seems to be going on with the long haulers and what's happening. And there's this long-term damage that has happened, likely from the inflammation, and the likelihood is that they're still dealing with that inflammation. So it's something that it's good to supplement for, and also, again, doing the oxygen and some of these rehabilitative therapies that we're doing to bring that, bring the inflammation back down, but also increase nerve function again, especially get that taste and smell back and to get the brain function back again. And of course, if you're still suffering with the shortness of breath, that's another amazing thing that we've been getting awesome results with, is the oxygen therapy with, I've even been using something called frequency-specific microcurrent, and we have a particular program that's geared towards virus recovery, post-COVID type recovery things. So, and we can dial it. It's a frequency-based machine that we can dial it in to the tissues that we're trying to heal as well. And I've been combining that with the oxygen a lot, and we've been getting a lot of amazing results. So I hope that helps. And if you know anybody that's dealing with, especially the taste and smell, or maybe the brain type symptoms, or even still the shortness of breath, let them know that we've been getting amazing results with that, and I hope to continue to help people in the future and get them rehabbed after all the injury that's been happening post-COVID. So, all right, guys, I hope that was helpful and informative, and I hope you guys have a great rest of your day. You guys take care.